So, dear students, today our topic is hormonal regulations of lipid metabolism. So, before going to the hormonal regulations of lipid metabolism, we can overview regarding the lipid metabolisms. So, this chapter is mainly concerned with the beta oxidation, that is the breakdown of the beta fatty acids. It can yield the energy. So, that energy was utilized for the growth and development of the body, or it was required for the various biochemical reactions. So that's why, so this chapter, it mainly concerned with the how the body can got the ATP for regular process. Okay, so next one that was considered with them. Also we can study regarding the ketogenesis and ketolysis, that is the formations of ketone bodies, and as well as the metabolism of ketone bodies that can responsible for the productions of the acetyl CoA. So then the acetyl CoA enter in the beta oxidation, then once again it can produce the ATP. So that's why the ketone bodies, so they are known as the energy rich biomolecules. So they are helpful for to give the energy to the our body. So in the case of the starvations, in the case of the restrict calorie intake diet is there, or in the case of the carbohydrate deficiency, or the persons on the fasting or starvations, the source of energy for our body is a ketone bodies. So that's why the ketone diet, so that was helpful for to lose the body weight, but artificially, okay, so those are enhanced the ketogenesis or ketone body synthesis, that was known as the ketosis. And ketosis is also, if it is excess mean, it can create the problems on the kidney, problems on the hearts, and problems on the brain. So that's why, so what naturally will be going on, so that should be go. Okay, so next one, so that should be the, we can consult the study regarding the biosynthesis of fatty acids. So how the fatty acids are synthesized in our body, so where, who can give the carbon dioxide. Okay, so what is importance of carbon molecule, sorry, the important additions of the carbon molecules, who we can supply, how the acetyl CoA can cross the mitochondrial matrix. So whatever that will be the consider with the biosynthesis of fatty acids. So that was essential. Fatty acids are essentials for the, once again, the development and growth of the body. And also we can consider study regarding the that is biosynthesis of lipids, like a phospholipids, triglycerides. Okay, so we are learn, so that is a, also we can learn the how the um, triglycerides are helpful, and phospholipids, so how they are helpful to your body, how the plasma membranes are depending upon the phospholipids. So that that were all we can study under the biosynthesis. Is also in the end of that respective unit we can study the that is regarding the insulin, glucagon, epinephrine, non-epinephrine, certain ketogenic amino acids, non-ketogenic amino acids, how they reflects on the these pathway. Okay, so then also we can study regarding the biosynthesis of cholesterol, and also we can know the learn the regarding the importance of cholesterol, how the cholesterol is required for the body, and how the cholesterol is required for synthesis of vitamin D or fat soluble vitamins, and as well as steroidal certain hormones like glucocorticoids, estrogen, progesterone. So they, everyone, they are depending upon the availability of the cholesterols. Okay, if these are excess, so then only it is considered as the abnormal lipid metabolism, then it was responsible to cause of the various disorders. But today our topic is, there is hormonal regulations of the lipid metabolisms. Okay, you also concerned with these pathway, so that was helpful for future to understand the what will be happen in the body during the patient counselings or diagnosis of the risk factors for the particular conditions. Okay, so first, that was the substrate ability. Okay, so if the substrate is more, okay, for fatty acid synthesis we require the acetyl CoA. Okay, okay, fatty acids are the, they are the lipid metabolism, they are involved in the our body, that was required for synthesis of the phospholipids, triglyceride, even the cholesterols. Okay, so that synthesis in our body, that was mainly depending upon the ability of the substrate. Substrate means, So those molecules are precursor essential for the synthesis of the lipids or synthesis of the fatty acids. If the substrate was more means the more lipids are synthesized and more fatty acids are synthesized. So next one is the allosteric reactions. Okay, so every molecule they having some active site, and every enzyme so they will be having the binding site for the substrate. Okay, that was known as the allosteric reactions. If the allosteric reaction is well, it going on the very well in the manners, so that is the whatever the factors are required, that is the cofactor coenzyme, so they are present means the allosteric reactions is a positive way, means the synthesis of the fatty acids lipids is also more. Okay, so these are the main two factors. So they are regulate the lipid metabolism. One is the ability of the substrate, another one is a allosteric reaction, that is the activations of the active sites on the enzymes. So as well as the enzyme ability or activeness of the enzyme, that is also regulate the each pathway. And here, so in the lipid metabolism, so this enzyme is play an important role in the biosynthesis of the lipids. So already you know, so this is the acetyl CoA carboxylase enzyme. So this enzyme is regulate the reaction, that is the conversions of or formations of acetyl CoA, that is carboxyl biotin, into a malonyl CoA. So malonyl CoA is the precursors. It can give the carbon dioxide as well as it is a source for the acetyl CoA. And whatever reaction so that was regulated by acetyl CoA carboxylase, so that was known as the commuted step in the fatty acid synthesis. Okay, so activeness of this enzyme, so that was also reflects on the biosynthesis of the fatty acids. If this enzyme is more active means the more malonyl CoA will be the forms. Okay, if this enzyme is less active means the malonyl CoA do not form. So lack of malonyl CoA, the elongations of fatty acids cannot be continued. So lack of elongation, the desired fatty acid do not synthesize. Already you learned during the biosynthesis of fatty acid that cycle was run for minimum 6 times, 6 cycles. Then only 14 carbon containing fatty acid like a palmitic acid was synthesized. Okay, so that palmitic acid was synthesized by additions of the carbon atom, that is the 2 carbon atom in the each cycle, and liberation of the carbon dioxide. Okay, so that is the role of the malonyl CoA, and malonyl CoA was formed from the acetyl CoA carboxylase, and this step is a um, committed steps in the fatty acid synthesis. So because so these steps is mainly depending upon the activeness of the acetyl CoA carboxylase. So dear students, so acetyl CoA carboxylase in our body, it is exists as a inactive protomer as known as the monomer, and as well as it is exists as a an active polymer. Okay, so this enzyme, so in our blood, in our body, okay, in our inside the cell, so where the fatty synthesis can be taken plus, so where it is exists as a in a two form. One is the inactive form, that was known as the monomer or protomer, and another one is a active form, that was known as the polymers. So here certain substrates are there, so that is the citrate. So this citrate, it enhance the polymerizations of this enzyme. Okay, this citrate, it can enhance the polymerizations of acetyl CoA carboxylase. It means it can enhance the ability of the active form of acetyl CoA carboxylase. So due to more presence of citrate or productions of citrate from the citric acid cycle, so it was enhanced the that is the formations of fatty acids by enhancing the formations of malonyl CoA, by enhancing the active polymer of acetyl CoA carboxylase. Okay, so that's why the citrate is a substrate. So it is enhance the polymerization of acetyl CoA carboxylase enzyme as a active polymer. So due to that, the more fatty acid is synthesized. Okay, so then, so another side, that is the palmitoyl CoA, then as well as the malonyl CoA itself. Okay, that is the palmitoyl CoA and malonyl CoA. So they can cause the depolymerizations of acetyl CoA carboxylase. It can convert active polymer enzyme into inactive by causing the depolarizations. That is the depolymerization, not depolarization, depolymerization. So due to inactiveness of this enzyme, as the substrate concentration is increases regarding the palmitoyl CoA and malonyl CoA, the fatty acid synthesis is decreased. So like that, so acetyl CoA carboxylase, it was involved in the regulations of the lipid metabolism by the substrate like a citrate or palmitoyl or malonyl CoA, or the nature of acetyl CoA carboxylase that was exist in a cell, that was also reflects on the biosynthesis of fatty acid. So like that, so this enzyme, so it was involved in the regulations of the fatty acid. So now we can consider regarding the certain hormones. So they are present in the body. So they are also involved in the regulations of the lipid metabolism. What are the hormones? So those are involved in the regulations of the lipid metabolism. So they are mainly categorized into two types. That is the anabolic hormone, and second one is a catabolic hormones or catabolic components. So here the anabolic means, so those hormones are substrate or molecule involved in the build-up reactions. That is to utilize the smaller molecule involved in the formations of the large molecule, and such effect was known as the anabolic effect. Okay, so whatever the reactions, molecular reactions where larger particle can converted into a smaller particle. Okay, and such reactions was known as the catabolic reaction, and that effect was known as the catabolic effect. So whatever the hormones those involved in the catabolic effect, and such hormones are known as the catabolic hormones. So due to effect of these hormones, so these are mainly categorized into anabolic hormones and catabolic hormones. So due to their only their effect, so that's why you consider, so those hormones they involved in the anabolic effect, how they are control the or to regulate the lipid metabolism, as well as the catabolic effect hormones, how they regulate the lipid metabolism. First we consider regarding the anabolic effect, those produced by hormones like parasympathetic nervous system. It can show the anabolic effect in the lipid metabolism. It means it is helpful for the biosynthesis of lipids. Then insulin, then glucocorticoids. So these are also involved in the anabolic reactions to show the anabolic effect, or involved in the lipid metabolism or bios enhance the biosynthesis of the lipid. And these following like a sympathetic nervous system, it was involved in the catabolism, breakdown of the lipids. Okay, they decrease the synthesis of the lipids or storage of the lipids. Then glucagon is a hormone that is also show the catabolic effect. Epinephrine, norepinephrine, thyroid hormones, and growth hormones. So these are all shows catabolic effect on the lipid metabolism. So now we can go for the one by one. So regarding the anabolic effect, so these are three molecules. So they are involved in the build up the or to enhance the lipid metabolism. First one is the parasympathetic nervous system. Okay, so this system already you know. Okay, it is the opposite to the sympathetic nervous system, and this system it can enhance the digestive secretions or the digestive enzyme, and this system is also stimulate the food intake. So as the food intake is increases, then we can take the more food along with the more lipid, then those lipid are metabolized and involved in the formations of the more lipid in our body due to increase the food intake. So like that, the parasympathetic nervous system, it can shows the that is enhance the, or it can show the anabolic effect on the lipid metabolism through a vagus nerve, or increase the food intake through a central nervous system. So next one is the insulin. So insulin is a hormone, so that was synthesized from the pancreatic gland, okay, from the beta cells. Its major function is it was involved in the regulations of the plasma sugar level. It always releases when the blood sugar level is increases, then the insulin was releases from the beta cells of the pancreatic gland, and that insulin was involved in the to decrease the sugar level. But in another side, the insulin is also participate in the lipid metabolisms through promoting the synthesis of the fatty acids in the liver. So lipoproteins, that is sorry, the insulin. So in the liver, it can enhance the gluconeogenesis. Okay, that is the form. Sorry, it can inhibit the gluconeogenesis. Okay, then it can enhance the formations of the lipoproteins and formations of the triglycerides. So due to that, the more lipid can be formed under the influence of the insulins. In another side, insulin is also inhibit the breakdown of the fats in the adipose tissues by targeting the lipase enzyme. So this lipase enzyme, it was required for the to dissolve the depot of the fat, or FD of the fat in the form of triglyceride that was present in the adipose tissues. So this insulin, it can inhibit the lipase enzyme. So due to that, the triglyceride is not metabolized. In another side, in the liver, it enhance the synthesis of triglyceride. In the adipose tissues, it inhibits the metabolism of triglyceride. So like that, it can enhance the synthesis of the triglyceride and ability of the triglyceride, or the depositions of the triglyceride. So like that, the insulin, it was involved in the regulations of the lipid metabolism. So next one is the glucocorticoids. So glucocorticoids are the hormones. So they are secreted from the adrenal cortex. So adrenal cortex, it is a covering layer of the adrenal medulla and adrenal medulla. So they are present in the cap of the each kidney. So they are secret the one hormones. So those hormones are known as the glucocorticoids. So as the name indicates, so these glucocorticoids, they are mainly involved in the regulations of the glucose. Once again, during the starvation, stress, or workload, we require the more glucose. So that glucose was supplied by the glucocorticosteroids. So these glucocorticosteroids, it can enhance the glucose synthesis or ability of the glucose. But on same glucocorticoids, it is also involved in the lipid metabolisms. Okay, so regarding lipid metabolism, so glucocorticoids, it can enhance the that is the uh, adipogenesis, that is the synthesis of the triglycerides in the lipids. The excess of free fatty acids that can convert into triglyceride in the uh, that is the adipose tissues. So that is the work of the glucocorticoids. But in acute condition, so glucocorticoid, it is enhance the beta oxidations. It can decrease the depositions of the lipid. But in chronic use of, or chronic release of, or longer release of glucocorticoids, it is always enhance the synthesis of the fat, or synthesis of the lipid or triglyceride, and also it can enhance the depositions of the lipid. So like that, so here they can enhance the lipid metabolisms, or sometime it can increase the lipolysis or decrease the lipolysis, or increase the triglyceride synthesis. So that is depending upon the secretions. If it is smaller quantity, shorter duration, then it can cause the lipolysis. If it is longer duration, it can enhance the depositions of the fat. So like that, so these three molecule or component or hormones, so they are always to shows the anabolic effect to enhance the synthesis of the lipids. So that's why they are involved in the regulations of the lipid metabolism. So now we can concentrate regarding the catabolic effect of the hormones. So those hormones are involved in the to decrease the lipid depot or formations of the lipid metabolism. So these are the There is the sympathetic nervous systems, glucagon, then epinephrine, norepinephrine, thyroid hormones, and growth hormones. So they are decrease the depositions of the lipid or synthesis of the lipids. Okay, sympathetic nervous system, it is completely opposite to the parasympathetic nervous system. So sympathetic nervous system, it can decrease the food intake, and as well as the sympathetic nervous systems in the liver, it can decrease the biosynthesis of triglyceride and biosynthesis of the cholesterol. So like that, the sympathetic nervous system, it was responsible for to decrease the lipid metabolism or lipid synthesis. So like a glucagon, so glucagon, it is the hormone that was secreted from the pancreatic gland from the alpha cells. Okay, so those alpha cells, so they secrete the glucagon. So this glucagon is mainly involved in the regulations of the glucose. So when the glucose level is less than normal, so on that time the glucagon is released, it enhance the blood sugar level. But in another side, same glucagon is also involved in the regulations of the lipid metabolism. So in the side of the lipid metabolism, the glucagon, it mainly inhibits the fatty acid synthesis. Okay, glucagon is a pancreatic hormone. It was mainly inhibit the fatty acid synthesis. So like that, the glucagon, it can decrease the lipid formations in our body by inhibiting the fatty acid synthesis. Okay, so next one is a epinephrine, norepinephrine. So these are the catecholamines. These are the neurotransmitters. So these are the neurotransmitters of the sympathetic nervous system. So these are play an important role in the regulations of the blood pressure. So when the blood pressure is the drop, so then these hormones, so they can enhance the blood pressure. But regarding the lipid metabolism, so epinephrine, non-epinephrine, so they can stimulate the beta oxidation. So due to stimulation of beta oxidation, the fatty acid depot that was decreases. So like that, the epinephrine, non-epinephrine through a cyclic AMP dependent protein kinase A enzyme that can be activated. So due to activations of this enzyme, the more beta oxidation can be occur. So due to that, the lipid depot can be decreases by the beta oxidation by a release of epinephrine or non-epinephrine. And also epinephrine, non-epinephrine, it can stimulate the lipolysis, that is the breakdown of the fatty acids in the liver. So like that, so epinephrine, non-epinephrine hormones, so they are involved in the lipid metabolism where so they decrease the lipid synthesis by enhancing the beta oxidation through a cyclic AMP dependent protein kinase as well as by enhancing the lipolysis. So another two hormones like a thyroid hormones T3, T4 and the growth hormone. The growth hormone is the pituitary gland hormones, the both hormones, so they are involved in the down regulations of the lipid metabolism. So they decrease the lipid metabolism by enhancing the beta oxidation. Because so these two hormones, they are mainly involved in the development of the body. So as the development of the body is more or the growth is more, they require the more protein synthesis. As the protein synthesis will be more, they require the more ATP, and we can got the more ATP from the metabolism of the lipids or from the beta oxidation. So that's why the thyroid hormones and growth hormones, so they enhance the growth through a enhancing the beta oxidation or through a enhancing the metabolism of the lipid. So here the glucocorticoids and growth hormones and thyroid hormones, they are facilitate the lipolysis by inducing the synthesis of the lipoproteins. Then as well as glucocorticoid induce the synthesis of the hormone sensitive to lipids. So that was involved in the breakdown of the lipids. So that's why the glucocorticoids, it will be having the mixed type of the action. It having the both action, but that is depending upon the ability of the concentration. For smaller duration, it is decrease the lipid metabolism. For longer release or longer dose, longer concentration, it can enhance the lipid synthesis. So that's why the glucocorticoid, it will be having the mixed type of the actions on the lipid metabolisms. So like that, so these four, that is sympathetic nervous system, glucagon, epinephrine, non-epinephrine, thyroid hormones, growth hormones, they are participate or involved in the regulations of the lipid metabolism by inhibiting the synthesis of fatty acids by enhancing the beta oxidation as well as lipolysis. So now we can go for the, so regarding the defective metabolism of lipids. So if any problems in the enzymes or lipid metabolism, then the person was suffering from the various kind of the lipid metabolic disorders. Among the few importants are a dyslipoproteinemia or dyslipidemia, that is the decrease the biosynthesis of lipoproteins. So lipoproteins play an important role in the transports of the cholesterol, triglyceride from GIT to the different parts of the body or from different part of the body to the towards the liver or towards the adipose tissue for the storage purpose. Okay, so the deficiency of the any metabolisms in the synthesis of phospholipids or lipoproteins, then the person was suffering the deficiency of lipoprotein. So that condition was known as dyslipoproteinemia or dyslipidemia. So another condition is the fatty liver, that is the excess of accumulations or excess of synthesis of the triglycerides in the liver. So that was responsible to cause of the accumulations of the triglycerides. So liver having one phenomena. So how much body is required the triglyceride, that much only it can synthesize the triglyceride. But in the abnormal metabolism of the lipids, on that time there is no restriction the entry of the free fatty acids into liver. More free fatty acids enter into liver and liver involved in the synthesis of the more triglyceride, and that condition was known as a fatty liver. So next one is the atherosclerosis, that is the depositions of the cholesterol or bad fats in the blood vessels in the arteries, so that can create the problem in the passage of the blood. So that condition was known as the atherosclerosis. Next one is the coronary heart disease. Once again, by blockage of the coronary circulation due to accumulations of the cholesterol or bad fat, then the heart do not got the adequate oxygen or nutrition or blood. That condition was known as the coronary heart disease. Next one is the myocardial infarction due to accumulations of fat. The myocardium or the tissues of the cardiac muscle was failed or inflamed. So that condition was known as the myocardial infarction. That is also occurred due to the abnormal metabolism of the lipids or accumulation of lipids. And the stroke, that is the accumulations of lipids in the brain, so that can create the deficiency of supply of oxygen to the brain. Then the brain can suffer from the stroke. Due to stroke, the death is also occurs. Next one is the hypercholesteremia, that is excess presence of the or increase the concentrations of the cholesterol in the blood due to any defective metabolism of the biosynthesis of lipid. Then the more cholesterol is formed in our body, so that condition was known as the hypercholesteremia. For your syllabus, so they are mentioning that is the fatty liver, then atherosclerosis and hypercholesteremia. So now we can see one by one shortly. So then these lipid associated disorders occur due to nutritional imbalance, okay, lifestyle change, habits, genetic abnormalities, and secondary cause of the other diseases are also responsible to cause of the abnormal lipid metabolism or lipid metabolism disorders. First one we can go for the atherosclerosis. So you can see that this image, so this is the normal arteries and this is the atherosclerosis artery. So here the lipids was deposited. Okay, so due to that the diameters of the blood vessel is decreases due to depositions of the excess of the lipids in the layer of the blood vessels or artery. So that condition was known as the atherosclerosis. So atherosclerosis is nothing but thickening or hardening of the arteries. So it is caused by the buildup of the plaque in the inner lining of an artery. So that's why it is also known as the arteriosclerosis. That is the accumulations of the bad fat or bad cholesterol in the wall of the blood vessels, especially in the arteries, in the form of the plaque, is known as the atherosclerosis. It is related to the arteries. That's what is known as the arteriosclerosis. The plaque was made up of the deposits of the fatty acid substance like a cholesterol, cellular waste products, and as well as calcium and the fibrins. So it is built up in the arteries, then arteries walls are become the thickened and stiff. So due to that, they cannot control the blood vessel, then the functions, the normal functions of the blood vessels, then the blood pressure is increases. So that's why atherosclerosis is also responsible to cause of the cardiac failure or heart failure. So regarding the risk factors for development of atherosclerosis, the high cholesterol, triglyceride level in our body, are high blood pressure, smoking, type 1 diabetes, obesity, physically inactive, then high saturated fat diet intake. So these are the risk factor. So those are response for the atherosclerosis. So that's why you should be avoid the excess of cholesterol synthesis in our body at triglyceride by taking the fibrin containing food. Also, you can control on your blood pressure by avoiding the laziness, by involving in the exercise, daily regular exercise. Okay, at least 25 minutes per sessions. Okay, then always quit the smoking and control on blood sugar level, control on body weight, or avoid the physical inactivity, or avoid the intake of the high saturated fat. Then we are free from the atherosclerosis. So regarding the treatment for atherosclerosis, that is the eat healthy, heart healthy diet, then regular exercise, weight loss, then medication like statins, anticoagulants, cholesterol lowering medication. So they are helpful for the treatment of the atherosclerosis. So next one is the fatty liver. So you can see the images. So this is the fatty liver, that the excess of fat can accumulate in the liver, and this is the normal liver. Okay, so fatty liver is also known as the hepatosteatosis. So fatty liver refers to depositions of the excess of the triglyceride in the liver cells. So dear students, actually the triglyceride, so they are synthesized in the liver, but they do not stored in the liver. Only 5% of the lipids or triglyceride that was stored in the healthy liver. Okay, if it is excess or due to abnormal metabolism of the lipid, then the more triglyceride that was accumulated in the liver, so that condition was known as the fatty liver. So due to abnormal lipid metabolism, so where the more fatty acid, so they are enter in the liver cells. So due to that, that liver is involved in the synthesis of the more triglyceride that was stored in the liver, then the liver become the fatty liver, or the normal functions of the liver can be decreases. So that condition was known as the fatty liver, and fatty liver is also responsible to cause of the fibrotic changes, and also responsible to cause of the cirrhosis or failure of the liver. So regarding the types of fatty liver, so that is the, there are mainly four types. That is the alcoholic fatty liver, due to over taken of alcohol that can cause the alcohol fatty liver. Then non-alcoholic fatty liver disease, then non-alcoholic steatohepatitis, then as well as the acute fatty liver of pregnancy. Due to pregnancy, the more fat can be accumulated due to secretions of the more progesterones. On that time, the more lipid can be accumulated in the liver. That's why that was known as the acute fatty liver. So regarding the reason for fatty liver, so there fatty liver can be causes due to increase the synthesis of the triglyceride. So dear students, so triglyceride, so they are mainly synthesized in the liver, but it cannot be stored in the liver due to abnormal lipid metabolism. The more fatty acid that can penetrate, mobilize into the liver, then the liver utilize those fatty acids, then involved in the synthesis of the triglycerides. So like that, due to more entry of fatty acids into liver or mobilized into liver, the more triglyceride or synthesis that was responsible to cause of the fatty liver. And as well as the diabetes mellitus is also responsible for to cause of the fatty liver, because the excess of the glucose, so that was converted into triglycerides or fatty acids. So then the more fat can be deposited in the liver, that is also responsible for the fatty livers due to diabetes mellitus are uncontrolled on the blood sugar level. So another reason for the increase of synthesis of triglyceride, that is the starvations or alcoholism or high fat diet intake. So those are responsible for to increase the synthesis of the triglycerides. So regarding the impairments of the lipoprotein synthesis, the lipoproteins already you know, there is VLDL, LDL, chylomicrons, HDL. So these are all are the lipoproteins. So they helpful for the transports of the triglyceride cholesterol from one place to the another place. So where they are required. Okay. So lack of or impairments of the lipoprotein synthesis. Then also those lipids or triglyceride cholesterol they cannot be mobilized from the liver. Then so they are accumulated in the liver. Then the fatty liver is occurs. Okay, so that is the impair the lipoproteins due to lack of vitamin E as antioxidant, lack of vitamin C, certain hormonal imbalances so that cause the impairments in the lipoprotein synthesis. Then they are responsible to cause of the fatty liver. Regarding the hypercholesteremia, so in case the cholesterol in the blood is known as the hypercholesteremia. So this can it can be sporadic according with the no family history or with the family history. And cholesterol is the one form of the hyperlipidemia. So high cholesterol can limit the blood flow, increasing the risk of heart attack, stroke. It is also detected by the blood test. And high cholesterol has no symptoms. So these are the chart that is guidelines for the cholesterol in our body. Okay. Then the regarding the treatment for the hypercholesteremia, that is eat the healthy diet, regular exercise, weight loss, medications like statins, anticoagulant, cholesterol are lowering medications, so they're helpful for the treatment of the hypercholesteremia.